Okay, our next presenter is Joe Dreiling. Joe is the Director of Palliative Care for Chapters Health System and works out of the telecom office. He will be presenting Hard Choices for Loving People books. You will find the grant summary on page 4, grant application number 6. This grant aligns with the chapter's mission as we serve patients at Florida Hospital and several nursing homes in navigating the maze of healthcare options and next steps. Joe started his career in the engineering field, but found a calling in healthcare, so he changed careers midlife and has been serving seniors with serious illness and at end of life ever since. Welcome, Joe.
Thank you. Many of us have gone to the hospital or to a nursing home or even to a doctor's office and have received some unexpected news. At that time, we're shocked. And if not shocked, 100, even 1,000 of thoughts are racing through our mind. Sometimes the doctor or the specialist does a wonderful job of explaining things, but most often their focus is on the diagnosis and not the individual. That is when palliative care is consulted. You see, palliative care is specialized care for people with serious illness. We focus on providing relief from the symptoms and stress of a serious illness. Our goal is quality of life for both the patient and their family. I'm proposing the purchase of Hank Dunn's handbook, Hard Choices for Loving People. It is one of the best tools our providers have found to assist them in this delicate work. They especially like the level of which it is written and the straightforward discussion it presents. Hank clearly presents the benefits of a treatment and also the burdens associated with it. You see, he provides both the argument for and against. This book is not a replacement for the discussion with the palliative care provider. It is something for the family to take home, to read and discuss amongst themselves. Our patients at Advent Health at Tampa are currently receiving this book through the hospital. My desire is to use this in the Tampa community, to start using it in our nursing home practice or even in our newly opened adult clinic. If approved, this grant program will help 2,000 patients and families. It will give them a different insight to their illness, and in many cases, relief. Many families have actually expressed to us relief after they had read the book. They have commented that it made them realize how many other people are facing some of the same or similar decisions. They were not alone. The cost of the program is $3,399. That amount reflects ordering 1,500 English books and 500 Spanish version books. The reason why no other community agencies can help is because many community agencies focus on the need on a distinctive group of people. Our need is very broad, not focusing on whom the person is or what the serious illness they have. I am passionate about this program because of my personal experience dealing with my elderly mother. You see, I was prepared for making those decisions. Both my wife and I have healthcare backgrounds, but most people are not prepared. As Hank Dunn had put it, healthcare providers must present the facts surrounding end-of-life decision making while offering comfort and support to patients and families. It's honest answers, practical advice, and spiritual guidance that are critical to helping patients and families during this most difficult time. The one thing I want you to remember is that all of hospice is palliative care, but not all palliative care is hospice. You see, palliative care is about the life that is left and not the end of life. This booklet will help our patients make those complex decisions regarding their care and loved ones as they take this unexpected life's journey. I thank you for your time.